So welcome back. My first guest is Dr. Mark Geller, the CEO, Executive Director of Montefiore Nyack Hospital. Welcome, Dr. Geller.
Thanks very much for having me.
So, Doctor, it's a delight for me to have you on the program. I've known you for a number of years. We're good friends, but more importantly, you really are a very important community leader here, not just in Clarkstown as a Clarkstown resident, but as the Executive Director, CEO of Nyack, Montefiore Nyack Hospital. And it's a critical part of our infrastructure and a critical part of the Rockland County area. And so you've got a big job, and we're hoping to hear a lot about Nyack and the changes there now that it's Montefiore Nyack. So welcome to the program.
Thank you.
And maybe we could just start off, I know you're a Clarkstown resident, but for the benefit of our viewers, you could tell us a little bit about your background,
Sure.
Where you were born, raised, and how you became a doctor.
Sure. Born in Brooklyn. Family moved here in 1963. My father took a position at Nyack Hospital as the chair of radiology. Went to elementary school. I was probably one of the last classes at street school.
Really?
And it was Little House on the Prairie.
Mm-hmm.
A graduate of Clarkstown North.
Mm-hmm.
And then went to Duke University for college and State University of New York downstate for medical school. So I moved away for school, did my residency in diagnostic radiology at New York Medical College, and then moved back when I took a job at Nyack Hospital. So lived most of my life in Rockland County, mostly in the New City area, but also in Muncie and Nanuet for short periods. Raised a family here. Very happy to have been a resident here for a good portion of my life.
Great. And your dad was a very well-respected doctor down at practicing out of Nyack in his own private practice, correct?
Yeah, so he started it in 1963 at Nyack Hospital and worked for the better part of 35 years, retired in early 2000. It was an interesting dynamic working with your dad, but it was also a big group, very collegial, cohesive, and very proactive. So he fostered in the group a spirit of trying to be as cutting edge as possible and delivering the cutting edge technology to the community. So after he retired, we continued to do that as a practice until I took my administrative role at Nyack Hospital. The folks in the radiology department still continue to do that, but maybe not as well.
Now, it's got to be difficult too, because your career is now segued where you're still a doctor and what have you, but you're an administrator now.
Mm-hmm.
So you're kind of like the principal in some ways. You're moving from teaching, if you will. You're moving from clinical care into more of an administrative type role, and those are challenges. That's a difficult move in any person's career. But I think you've done it extremely well, as witnessed by some of the changes, and I think some really good changes that have taken place with Nyack now as Montefiore Nyack in terms of the merger and in terms of just some of the expansion that's taking place there as well.
Yeah. So transitioning from a clinical role to an administrative role, I think having somebody in a leadership role as a physician or a clinical person helps connect the organization to the delivery of healthcare in a more profound way. Right. Because we're care providers, we understand the patient's experience, we understand the physician's experience. So I think it helps to have somebody who has a clinical background somewhere in leadership, whether it's CEO role or some other role. So I think it's been helpful for the organization to have someone in addition with a clinical background. But yeah, we've been doing a lot of things. We affiliated with Montefiore in sort of a. I like to compare it to being engaged. So we became engaged with Montefiore in 2014, and we actually became married in a more permanent relationship in February of last year. And in becoming married, we took their name. Mm-hmm. So we became Montefiore Nyack Hospital, and we chose Montefiore as a partner. They come from a social medicine background, where most community hospitals affiliate with the system. It's because the system wants to access the patient population of that area. So very much like hub and spoke, they want patients to be treated at the academic center. Montefiore is the converse of that. They want the community hospital to be as strong as possible, to be as robust as possible, to deliver care in the community. Their feeling is that it's, deliver care to the patients where they are, rather than force them to have care elsewhere. And in so doing, we deliver care in a less expensive fashion, because it's more expensive to deliver it in a tertiary care center. But we're also able, by virtue of this affiliation, to offer more things than we would as a community hospital, a standalone community hospital. So we leverage their support. So things like cancer trials, we get access to their cancer trials. Cancer surgeons, they're now coming on staff with us. And they've helped us take on programs that we might not have been able to do on our own. So it's been an extraordinarily supportive relationship for Nyack Hospital, but it's really because they want Nyack Hospital to be as robust and as profound an organization as it can be to support the community. So I think not only has Nyack Hospital benefited, but the community has as well.
No, absolutely. At Montefiore, I knew it from years and years and years ago. Early on in my career, I was in the priesthood, and I was actually assigned in St. Brendan's in the Bronx, one of my assignments. And Montefiore Hospital, their main hospital, was there, and they had done some expansion at that point as well. You had North Central General Bronx, was right next door, and I was into Montefiore plenty of times to visit, parishioners and folks in there, and it's great to see how Montefiore has evolved and grown throughout the years. And they really are, they have their teaching aspect, and they've got just a very robust delivery of services across the region. So it's, when Nyack affiliated with Montefiore, I think it was very good news for Rockland, and it was great news that you were there as the CEO to be able to kind of lead that initiative. Yeah,
and over the past 15 or 20 years, Montefiore has undergone a renaissance. They've become one of the premier academic institutions in the country. They've affiliated with and become one with Albert Einstein College of Medicine, so they now have a very profound relationship with the college. And they've committed in a very fulsome way to the Hudson Valley, to delivering care to the Hudson Valley. So they are now the largest system within the Hudson Valley in the 7 counties, with significant presences in Orange, Rockland, Westchester. And it's really to deliver care to a population of folks locally in a really high quality fashion. So we're proud to be part of the system and to be part of their renaissance.
Could you maybe speak to us a little bit about, you've had a bunch of new initiatives. I mean, you have the partnering with the county and working with the county in terms of mental health services. That's certainly one area maybe you could touch briefly on, and also the emergency room, and with the changes there and the construction that's taking place, and that's going to conclude, I guess, next year?
Yeah, the first half will be done this year, and the second half will be done next year. So we'll be halfway done and halfway occupied this year in the emergency room. So we've done a number of things in partnership with the county. In 2014, we took over the adult behavioral health inpatient services from the county. So we do now have a 26-bedded unit that addresses the acute needs of adults in the community. We also assumed from the county the prenatal clinic. So we're now providing services to underinsured and uninsured folks who are pregnant and require care. One of the bigger projects that we've undertaken in the last 5 years is what we call the Nyack Hospital, or Montefiore Nyack Hospital Transformation Project. The biggest piece of that is renovating and enlarging our emergency department. As the only provider of behavioral health services, inpatient behavioral health services in the county, we needed a much more robust presence in the ER for our behavioral health patients' needs. We're at Rockland County's trauma center, so we needed a more robust footprint for caring for trauma patients. And we are also the only hospital in Rockland County that has pediatric inpatient beds. So we needed a sort of a more dedicated space for our pediatric patients. So what we did was we are doubling the size of the emergency department. It's right sized for the volume of patients we have today, but it's tailored more appropriately for the types of patients we have today. So there'll be separate pediatric space, there'll be separate behavioral health space, dedicated trauma area, adult med surg. Every patient will be in a private room, and we'll have care providers in the emergency room specific to each of those needs. So in the behavioral health portion of the ER, there'll be behavioral health technicians, behavioral health RNs, psychiatrists. In the pediatric area, there'll be obviously pediatric RNs and pediatric physicians. So it will be a much more rational use of the space. It'll be right-sized for today's healthcare needs. And it will be, I think, spectacular. I can't wait to show it off.
Great, but we're looking forward to it as well. I've been down for the groundbreaking ceremonies, and we're looking forward to the completion over the next 2 years of this phase of it. So just great work on that. What keeps you up at night? As it relates to the hospital. I mean. It's such a challenge in the medical field, and not just at the innovations and kind of keeping forward, but just the challenges with the mergers and the acquisitions, and what's kind of taking place, and also then the changes from the federal government to the state government, and how that impacts. What are some of the big challenges you're facing right now?
Yeah, I think all hospitals in New York State face economic challenges. New York State is a more challenged state to run a hospital in. The average hospital in New York State has a margin of 1%. So with the sneeze or hiccup, it goes away. And then on top of that, there's a constantly changing regulatory environment, which impacts how you perform financially. So it's staying ahead of the regulatory piece, and yet operating in a way that you can continue to invest and support the hospital. So it's that delicate balance, and I think those are the major challenges for hospital administrators today. And then keeping pace with technology, making sure that you're delivering the highest quality care possible in an environment where there are economic challenges. And again, I go back to the Montefiore affiliation. We're doing things today that we would not have been able to do if we were alone. They've been our backstop and extraordinarily supportive in rolling out a number of programs that are new to the community for us.
So overall, it's been a tremendous partnership, and really, I think, great for Clarkstown and for Rockland and for the region. So how can people, I know you have a lot of events, and obviously as a CEO, not just running the hospital, but you have a foundation as well, and a foundation board. Are there any upcoming events or ways in which people can get involved, either through volunteering at the hospital or just helping the hospital with some of their future events?
Yeah, so we have a really robust volunteer program, and I would encourage anybody who's interested and has the time to volunteer. We have a really robust program for our teens and early adults to help introduce them to the healthcare environment. We have events throughout the year. Our next event is probably the breast cancer walk-run. We also have a fashion show at the street fair in Nyack in September. And next year is our 125th anniversary, so we're planning for our 125th gala. So we'll be working with the community to have events over the course of the year that celebrate the community and the hospital and our partnership.
Great. And we'd love to get details on all of those, and we'll help you spread the word on those as well. But last topic, just to finish up with, you've been a doctor now for a lengthy period of time, and you've seen a lot, and now you've moved into the administrative role. You have any advice or suggestions for young people looking to break into the medical field?
Yeah, listen, I think it's a wonderful world to work in, whether you're a physician or a nurse, a PA, or anybody in the healthcare delivery system in a hospital. So I think it's an opportunity to give back, to learn, to be stimulated. It's a constantly evolving environment. It's not without its challenges. It is expensive to get your degrees, but I think it's very rewarding ultimately, and can give a person a lot of job satisfaction. Nurses are the most trusted people in any profession, so I think that goes a long way in bringing joy to work. But in a hospital setting, there are just so many opportunities for people to engage. We're sort of a microcosm of the economy. So we have information technology people, human resources, environmental services, customer service, retail food. So there are a number of ways that you can work within the healthcare environment, maybe not being a direct healthcare provider, but supporting patients. So it really is, we encourage students to participate in all those areas to see where they might want to fit in a healthcare environment, but not necessarily be directly hands-on.
Great. And so if somebody wants to volunteer or learn more, how do they get in contact?
Our website has contact information. Helen Hayes Perkins is the head of our volunteer department, and she'd be happy to engage anybody who'd want to engage with us.
Right. And Helen Hayes Perkins happens to be a Clarkstown Police Auxiliary.
Yes, I've seen her in uniform.
You've seen her in uniform
yes,
here.
Yes.
Not just not wearing just the hat down at the hospital, but here, and she's actually one of our more active
Yes.
police auxiliaries. So,
yeah, she's terrific.
Yeah, she does a great job. Well, Dr. Geller, I want to thank you for your friendship, but I want to thank you for being such a great guest, and more importantly, just being one of the top executives living here in Rockland County and leading such a robust program at Nyack Montefiore. Thank you so much.
Yeah, thank you.
Great. All right. We'll be right back. Stay tuned.